Welcome to traumaticbraininjury.com. Traumaticbraininjury.com is the leading resource on the internet for resources regarding traumatic brain injury for survivors, families, and caretakers. My name is Stewart Cohen. Today's guest is Dr. David Lenrow. Dr. Lenrow is a physician who specializes in physical medicine and rehabilitation. He's on staff at the Hospital University of Pennsylvania since 1987, and he's also on the faculty at University of Pennsylvania Medical School. Dr. Lenrow is involved in treating patients with traumatic brain injury as a regular part of his practice. Dr. Lenrow, thanks for agreeing to appear on traumaticbraininjury.com.
Thank you for having me.
I want to ask you some questions about symptoms of brain injury. You were kind enough to send me a copy of the Center for Disease Control, the government's traumatic brain injury fact sheet, which lists a lot of information concerning the symptoms. It seems to me that with respect to some of these brain injury symptoms, the spinal fluid coming out of the ears and nose, loss of consciousness at the scene of an incident, that's fairly obvious, and the person's going to be taken immediately to the hospital and treated there.
Right. Those are medical emergencies, and certainly reasons to call paramedics 911 and be treated immediately.
And I guess we want to make the point specifically that the information about the symptoms that I'm going to be asking you here today are not a substitute for medical advice to going to see a doctor. And I know you encouraged me to make sure that we mentioned that here today.
Right. I mean, this is general information, certainly not aimed at treating anyone.
We've talked before about diagnosis of brain injury symptoms after the emergency situation, where someone has had a concussion and been released from the hospital, where someone has had a trauma involving many injuries, including a concussion or some type of trauma to the brain. And I want to ask you some questions about that now, okay?
Okay.
First of all, is a brain injury easily diagnosed by physicians?
Well, the more severe injuries are much easier to diagnose because they usually manifest themselves with problems with using certain parts of the body and obvious impairments, inability to speak or understand language or inability to move arm or leg. Those are fairly obvious injuries. The problem is diagnosing what we've called mild traumatic brain injuries, which generally only affect higher level brain function.
All right. Well, let's go over what some of those types of symptoms might be that are sometimes not easily picked up. Let me tick off a couple to you. Lethargy, sluggish, sleepy, getting tired easily. Is that a symptom of brain injury?
Yes, it is.
How does the patient, the patient's family, their family physician, distinguish that kind of lethargy, that tiredness, sluggishness, that you get from a brain injury from the kind of tiredness and sluggishness you feel from the incident? You know, for example, somebody's in an automobile accident, their body is bruised and beaten up, they've had fractures or multiple injuries to their body. They're going to be sluggish and tired anyway. How do you distinguish the two?
That's a difficult problem. It's difficult initially. So at the initial time of the traumatic event, whether it's a car accident or a fall, the medical professionals treating that person will do a good examination, neurologic examination. If the trauma was substantial enough, they'll also do some sort of imaging of their head to make sure there's no obvious major trauma. But if they go home and they didn't have any major obvious brain trauma, and these symptoms persist, and they're noted by the family or the person themselves, then it deserves further investigation.
All right. And you gave me a list of the kinds of symptoms that the families should be on the lookout for. And I just want you to go over this list with those folks that are tuning in today, all right? Sluggishness, lethargy was one. Headaches?
Headaches are very common after any sort of brain injury, but certainly mild traumatic brain injury is a very common symptom.
And at what point should the family start becoming concerned about the headaches persisting for too long a period of time?
If they persist for more than their normal headaches, they should at minimum discuss it with their general physician to make sure there's not something else going on.
Okay. Another one of the symptoms is confusion. What kind of confusion are you speaking about here?
Confusion is a very general symptom. It can range anywhere from the inability to do tasks that they could do before, so the checkbook is an easy example. Recognizing people who they've met before is obviously a little more severe. Doing activities that were easy for them and automatic before, other evidence of some confusion or problems with thinking.
Another category that you gave me was difficulty with thinking skills. What kind of things should be a red flag for family members?
That's a difficult thing for family members to pick out, but a very common symptom, particularly of people in high-powered jobs or executive sort of jobs, are people who have difficulties at work and increasing frustration. So a problem with managing general life skills and work skills, causing the person to come home and being upset or getting written up at work, if that's the case, those are all clues that something is wrong, and it could certainly be due to a brain injury.
Another item on your list is inappropriate emotional responses. Again, what kinds of things should family members be looking for?
Again, that ranges for quite a large spectrum of possible behaviors, from crying for no apparent reason, laughing inappropriately, being inappropriate in general, either verbally or with physical actions, are all signs of brain injury.
I know that there are a number of others on this list that you've given to me, and that will be available here on traumaticbraininjury.com. But I also see another one that says loss of bowel control or bladder control. What does that have to do with the brain injury?
The brain allows us to control those activities as well. And generally you don't see that in a mild traumatic brain injury, although it can happen. It's very unusual. It's much more often a more significant injury.
Does early diagnosis of these symptoms make a difference in the type of treatment somebody would get or the ultimate result or outcome?
It does make a big difference in the treatment people get. It also makes a big difference in how, particularly in mild brain injury, how it's going to affect their life. So if a patient understands that the problems they're having at work or with their spouse or family are related to an injury and not to the relationship or the job itself, they can take steps to fix those problems and not get frustrated and in a rut. So in that respect, it's very helpful. Just knowing what they have and that usually they get better is helpful. But it also helps them get into an appropriate program of treatment and diagnosis, which is very important.
One last area question, Doctor. A number of the people that are tuning into this are family members. And on their behalf, I want to ask this question. Suppose they're seeing these symptoms and they're approaching their family doctor and they're being told there's nothing that can be done about this. What is the job of the family in that situation? What should they do?
They should locate an appropriate resource. In this instance, a physician with a specialty in brain injury, whether it is a neurologist or a physical medicine rehab physician, but someone who treats this on a regular basis so they can direct them to the next step in treatment.
Right. And again, there are some lists of resources available on traumaticbraininjury.com for that very thing. Thank you, Dr. Lenrow.
Thank you.